you a quick tutorial and an overview of how the health management system works, which is basically a health solution for managing health records and as well as managing hospitals. And this is the interface. And to start off, a hospital is onboarded onto the system, and when that is done, a hospital administrator is created, and the credentials are sent to them securely, and and the different branches in that hospital, if they are, if the hospital has branches, they are created. And first off, I'll be taking you through the interface or the dashboard of the hospital administrator. So to do that, the hospital administrator logs in by clicking here. They enter the credentials that were created for them. So this is their dashboard. They can view a couple of things from cells to the different branches that were created. So let me give an overview of what the interface is showing. So you have the cells section that shows the total cells of the hospital, and things to do with lab results, radiology, medical drugs. And the next section is about the branches that were created and that are owned by the hospital. So there are two branches so far, which is the city branch and the downtown branch. And the hospital admin can also update data, so they can change the logo of the company. So they can update the company logo, then they can enter a slogan, they can enter a description if necessary, then they can submit that, and that gets updated. So we want to manage one of these branches. Let's select city branch, and for the city branch, there are a couple of things that we can manage. This is the dashboard that gives the different metrics from the total patients, active staff, appointments that are scheduled for the day, and then the daily sales, and then some visualizations. So the next tab is about the staff. So this tab is where staff members are managed. You can see that we have doctors, we have nurses, we have pharmacists, we have lab technicians, we have radiologists, we have receptionists, we have cashiers, and then we have branch admins. Yes, so to create a staff member, we have two options. That is uploading a CSV file or an Excel file. So to do that, you just click on that and you upload the Excel file. This is the file that we want to add. And yes, so when that is done, all the staff members that are in that Excel file will be uploaded and their credentials will be created. and emails will be sent to them. And emails will be sent to them the credentials that they can use to log in. They'll receive a one-time password, and they'll be able to log in and reset their password. So the second option is to actually create the stuff normally with a form. And let's create a new stuff that is Mary. That is Mary Jane. Let her be a doctor. And then we create our email. Yes, so she has been added successfully, and that is the process of managing the staff members. So the next part is for the drugs. So these are the drugs. This is the page where you can manage the drugs. You can also upload a CS.csv file or an Excel file. But to do that, we have a file already, which is this. You can upload that, and the drugs are created. You can see they have been created. Initially, it was only Panadol. Now there are a couple of drugs. So we also have the option of adding a drug manually. That is entering the name, its description, its side effects, its possible side effects, the batch number, the manufactured date, and the expiration date, the unit price, and then the unit quantity that has been purchased. And then for drugs that are managed in that are administered in tablets, you enter the tablets in a single packet, and then the tablet, and then the tablet price. That is to address patients that might want to buy individual tablets. So that is managing drugs. Then lab tests. We can create lab tests. So for now, the system only has a hepatitis B surface antibodies test. So to add a test, you just click on the add button, and let's create a malaria test. And the price can be 30,000 Ugandan shillings, and then we add the test. All right, then the next part is the radiology scans. So the hospital branch only has X-ray scans, so we can create a new scan. We can create a CT scan and attach a price to that. Probably 200,000 Ugandan shillings. Let me submit that. The next part is the inventory. The hospital can manage its inventory from this page. We can add, you can see that there's so far there's only a bandage, so we can add gloves, since they're essential. Category probably in the lab, they're used in the lab. Then the units, they're measured in boxes, and description is optional. Then the quantity of the boxes, let's say the hospital has purchased 50, you can add that, and it's successfully created. Then the beds, we can manage the beds still from the admin interface. So these are the beds that where the patients are admitted. You can see we have from B001 to 002, then to 003. So we can add an extra bed, that is bed 004, which hasn't been created yet. Then we add that, and then it's successfully added. The next part is the settings. So to do that, you can add, so on this page, there are a couple of things that you can do. There are default charges. That is the nursing care. That is for patients that have been admitted and will stay at the hospital for some time. We also have sundries, we have admission charge, we have doctor's review, and then we have meals. These are all costs for an admitted patient. And then we do have a consultation fee that you can update. So to do that, just click on this tab, then just click on that button, then you fill in the different charges. You can also go ahead to edit. Let's say the consultation fee is now changing from 45 to 50,000 Ugandan shillings. That can get updated there. Then we also have admission types. So a hospital has the ability to admit patients in different ways. So initially the hospital only has general, which is priced at this. So to add another admission type, we can say probably VIP, then the bed charges for that, which is let's say 500,000 Ugandan shillings. And then we add that. Yes, so it gets added in that section. Then the next part that I had to talk about was the button that allows you to actually reset your password. So when your credentials are given to you, you get a one-time password that you where you enter your one-time password, and then you enter your new password, and then you confirm your new password, and then you at last update that. Yeah, for data privacy and security. So the next part is we want to log out of this dashboard and look at the entire flow from when the patient arrives at the hospital to when they check out. That is for an outpatient. So to do that, we start off with the receptionist. So the receptionist logs into their account. Let me fill in the credentials. Yes, so this is the receptionist that the hospital admin created and gave permission. And they can also access a couple of metrics from total patients, admitted patients, to new appointments, pending admissions. So to admit and register a new patient that has arrived at the hospital, they just click on this button and they can record a new patient. So we can create a new patient. First name is James, last name is Harper, and you can fill in the different input fields. Occupation, an engineer, phone number, that. then their address, then their next of kin details that can be filled in now, but that is not mandatory. They can always be updated when needed. Can fill in the gender, the address, then the relationship, then the occupation of the next of kin. Then the next section talks about the payment details. That is, if they used cash, card, or insurance, they probably used cash, and this is the amount that they should pay that we set earlier on. Then we can save this record, and to access that, you can see that James Harper has been created and admitted. So we can now log out, and those details are sent. Those details are sent to the nurse that carries out triage. That is, we can access their dashboard. Let me fill in the credentials. Yes, so this is the nurse's dashboard. They can also view a couple of metrics. And so the record that the receptionist created is sent to the nurse to carry out triage after registering them. So under the triage tab, you can see that we have James Harper. And to carry out triage, you can just click on the action options, and under the options we have do triage. So we fill in a couple of metrics, that is height in meters, the weight, the temperature, blood pressure, and then next we fill in medical history, things to do with allergies. This person has none. Chronic illnesses, none. Medications, none, since they are new to the hospital. And then past surgeries, none. Then next is actually selecting a doctor to handle this patient. So to do that, the nurse selects a doctor that is available. So a doctor that has logged in is the one that will show up on this tab. So so we can log in a doctor, and we see that dynamically happening. Yes, so we can log in a doctor. This is the doctor that we created, and their credentials are that. Yes, so they have logged in, and now the nurse should be able to see Dr. Jonathan Reyes, who specializes in internal medicine, is available on duty, and they can save that. So on saving that, those credentials, that data is sent to the doctor, and you can see that the metrics updated, so the doctor can also see the total patients, the daily patients, pending lab results, then appointments, and a couple of visualizations. So the doctor can also update a few things in their biodata. You can see that they deal in internal medicine, that's their license number, and a couple of other necessary data. So the patient that we have just sent to the doctor is James Harper, and yes, for the doctor to provide the necessary medical support to this patient, they under the action options they click on view details. Yes, so on viewing details, they have access to the different demographics that the receptionist captured, that you can see over here. Then triage information that the nurse has just entered, and then clinical notes. Clinical notes are taken by the different doctors, so doctors have access to all past history of clinical notes for better context and medication. So the next thing that the doctor can do on this page is add a lab test, that is requesting for a lab test for this patient. So you can see that the different lab tests that the hospital admin created show up here. So we can select a malaria test. You can submit multiple tests. That is also an option. But let's request for a malaria test for this patient. And when that is done, the lab technician for this hospital will be able to view that. Yes, so when the lab technician logs in, this is their dashboard. They can also view a couple of things from samples processed, lab tests awaiting, pending reports, completed tests. And so under the tests tab, we can see that James Harper, who's over here, the status of their lab result is pending, and they haven't yet paid for the lab test. So before the lab technician proceeds, this patient should pay for that lab test. So to do that, the cashier now gets involved. So on the cashier's dashboard, you can see, let's first log in. Yes, so this is the cashier's dashboard. They can also view a couple of metrics from the total sales, daily sales, pending payments, cash at hand. And so for the patient to pay for their lab test, under the laboratory tab, you can see James Harper is over here, and their lab test is worth this amount. And all the cashier has to do is to change the status to fully paid from not paid to fully paid. And then that updates automatically, so when that is done, the lab technician is notified so that they can work on that patient. So we can log in again. So under the tests tab, you can see that this patient has paid, and the lab status is pending. So to update the findings. The lab technician clicks on view more details, where they have to fill in a couple of things. That is the result. The patient is positive, reference range is that, status is that, and then the unit is that, and then we can submit those findings, and then the status is automatically changed to complete. So those results are then returned to the doctor. We can log in as a doctor again to see what how the data looks like. Yes, so when the doctor logs in under the lab results tab, they can see that James Harper is over here. So they get notified when their status is complete. So they can view details of this patient, and they have access to the report that was created. So for the malaria test, that is the status, result is positive, that is the reference range, and then the unit. Then after diagnosing that, the doctor then finally gives a diagnosis. The patient has malaria, and then makes a prescription. Let's say quinine, and then when the doctor submits that data, it is automatically sent to the pharmacist. So the pharmacist is responsible for issuing out the drugs. So we can log in as a pharmacist, and then we see that data. Yes, so when the pharmacist logs in, they have a similar dashboard where they can view total drug sales, prescription refills, stock status, and then pending payments, and a couple of other important metrics. And so under the diagnosed patients, since the patient has been diagnosed by the doctor, you can see that the drug invoice is not yet determined by the pharmacist, and the status is not yet paid. So to administer a drug to this patient, all they have to do is under the action options, they can administer. The second option is here, so they can administer a drug. They can administer a drug. So to administer, because the doctor requested for quinine, it is not available. The pharmacist has the option to edit that and provide the drug that is available. So to edit the prescription, the nurse, the pharmacist can change this. Let's say we are now giving the patient paracetamol. Then we submit that. So that has changed, and we can now administer based on the drugs that are available. So you can see we have paracetamol, and that is the quantity. Let's say this patient requires 4 packets, and then they do not require tablets. This option is for patients that are buying individual tablets. That is also catered for. Then the dosage, let's say 1 times 1. And then we can always add another drug. We can always add another drug. If it's not necessary, you can always remove it. But let's stick to that because the doctor prescribed paracetamol. So we can submit that, and we see how the data flows. So the total drug invoice is this. So the total drug invoice is automatically calculated, and the status is not paid. So the pharmacist cannot issue the drug to the patient until they clear with the cashier. So to do that, the cashier Yes, so to do that, the cashier accesses that patient with the drug invoice. You can see James's record is here under the receipts tab because they're going to receive a final receipt. So to change the status to fully paid, they just click on that, and then the status is changed to fully paid, and then they can always go and get access the drugs from the pharmacist, and then at the end they can receive a receipt, consolidated receipt, detailed receipt that shows the consultation fee, the lab test, the drug, the amount they spent on the medical drugs, and the total in Ugandan shillings, and then also the name of the patient, the payment date, and the service, and the name of the cashier that provided the service, and they can always print that when needed. Yes, so we can look at so we can log out. So we can log out and actually look at the radiologist and how the data flows between the doctor and the radiologist and the patient. So we are looking at a scenario when the patient that we just registered requires also a radiology scan. So under the patients tab, let's also request a radiology scan for this patient. So as I had earlier stated, that they can do a couple of things on this page. So they can add a radiology scan and also a clinical note. So for a clinical note, they can always enter any note that provides better context when it comes to medication. Probably the doctor can enter headache, stomach pain, and the necessary notes. And under this tab that I had shown you earlier, you can see the clinical note has been created, and it records the date and the time, the note itself, and the actual doctor that created that note. and we can always export this patient's data with two options, that is as an Excel file. So to do that, just click on that button, and then an Excel file is automatically created for you. We can also export. Let's just look at how it's structured. So we can also export the patient's data as a PDF that we can look at as well. Yes, you can see. So for this patient, that is the hospital, that is the date it was exported. That is those are the demographics, next of kin data, triage data, the different lab tests, the different clinical notes. And yes, this is the exported Excel file. We can also view the same details, demographics, next of kin, triage information, lab results, clinical notes, and then radiology scans. So the next part that we shall look at is requesting for a radiology scan. We had created a few scans, that is the X-ray and CT scan. So we can request an X-ray scan for this patient, and let's say the target area is the wrist, so we can submit that, and then the radiologist should be able to receive that data. So we can log in as a radiologist. Yes, so the radiologist, their dashboard is also similar to the rest. So they can view the total scans, pending reports, equipment status, completed reports, among others. So under the scans tab, you can see that James Harper requested for a radiology scan, but status is pending and the payment status is not paid. So to do that, we go back to the cashier. So the cashier is always notified when all these requests come in. Yes, so under the radiology tab, you can see the status is payment status is not paid. So we can change that to fully paid, and then we can access the radiologist's dashboard again. So to do that, change the status to that, then we can log out and access the radiologist's dashboard once again. Yes, so once they are fully paid, they can always update, and they can always upload the report. So the radiologist can do also a couple of things, from uploading the images after the scan is complete and also uploading a report. So you can upload some images. You can upload an image. You can upload this image. So if the radiologist wants to upload another image, they just click on this. They can go ahead and upload another one. Let's upload the similar image, then we submit that. And so under the report, they have three input fields, that is the findings, We can enter some dummy data. We can enter the same value again. And then the conclusion, anything that gives better context to the report, probably immediate medical help. Yes, so when they submit that report, the data is sent to the doctor. So we want to see how the doctor views that data. So we can log in again. I can log in again as a doctor. So under the radiology tab, which is over here, you can see that James Harper is right there, and the doctor can always view the details for this patient. So this is the report. You can see the different fields that were entered by the radiologist and the images that were uploaded for the doctor to view. And they can always download that if needed. And the next part is to actually looking at inpatients. These are patients that are going to be admitted and spend some time at the hospital. So how the system handles those patients is they start off with the receptionist. So we can log in again. Yes, so you can see that James Harper, who went through the entire process, has been successfully discharged. But we're also looking at a scenario where they now come back the following day for medical help. So initially we registered them from here, and but when they come back, their details are already in the system, and all the receptionist has to do is send them for triage. So to do that, they just click on the second option, and then that sends them for triage to the nurse, and then they go through the entire process again. So if we want to admit this same patient, who is James Harper, to stay at the hospital for a couple of days, we choose the third option, that is admit patient. So to admit the patient, we have the two admission types that we created, that is general and VIP. So we can select general and select a bed. Since they're all free, we can select 001, and then we submit that. So this patient, so you can see that under the inpatients, these are the admitted patients to the hospital. You can see James Harper and the bed ID the bed number, and the status, and the admission status, which is ongoing. So earlier on, it was John Doe using this bed, but on discharging them, they freed the bed for other patients to use. So we are also going to look at that briefly, how that data flows. So when a patient is admitted, doctors have access to that information. Yes, so under the inpatients tab, you can see that James Harper is over here, so the doctor can view the details of that patient. They can add a note that is on making checkups, regular checkups, daily checkups on the patient. So they can add a note that is monitor the vital signs every 4 hours, especially blood pressure and the other vital signs. So the doctor can submit that, and then the nurses that actually administer this support to the patients receive that information. So we can log in as a nurse now to see how that information is portrayed. Yes, so the nurses also have uh, access to the inpatients. So you can see that James Harper is over here, so they can view the details. They can view the details for this patient, and they have access to the doctor note, which is to monitor the vital signs every 4 hours. So they can also add a note on the different utilities that uh, they they will be using on the patient. So they can also enter the note. That is also optional. Probably they can just enter that, monitor the vital signs, and then they can use the items used. They can enter the items used, and let's say they used gloves, and then they enter the quantity they used. Let's say they used 4 gloves, price per item is that, then they submit that. So they can enter the different notes, the different utilities, recording the different utilities that were used, and that records the nurse that actually administered that, and then also records the date and the time that note was made. So they can always add other notes, and so for the different days that the patient will spend at the hospital, those costs accumulate automatically, and a detailed report is created. So to access that report, that can be issued by the cashier or anyone in the financial department. So you can log in again as a cashier to view that. Yes, so another inpatients tab, you can see James Harper who's over here. Then we can always view their report, a detailed report, starting from the patient name, the patient ID, the bill type, the account, the age, the bill date, admission date, the number of days spent at the hospital, the type, and then and then the bed number they're actually admitted to. So these are the different costs that we actually set earlier on. So there's an admission charge, the bed charge, nurse care, doctor's review, sundries, and meals. So this total amount is dynamically recorded and calculated based on the number of days that the patient stays at the hospital. So you can also see that November 4th, gloves were used, and this was the total price for that. So at the end of it all, it records the different costs for each day that you spend, and gives you a total invoice amount, which is recorded here. And to discharge the patient, you can just click here. So when you discharge the patient, basically three things happen. That is, it changes your status from ongoing admission to discharged. It frees up the bed so that other patients can be admitted to that bed. And then it also stops the number of days counting. So to do that, just click on that button, and then the patient is discharged successfully. So I'll also be taking you through how the hospital admin views this whole information at last. And so when the hospital admin logs in, they also have access to view the different sales information. And basically, to do that, they can select a range of days. They can select a start date. So let's say they want to access the sales information for the month of the entire November. So they can just select 1st November, and then they can select the end date as 30th November. So you can always select a range of days that you feel is appropriate, be it a fortnight, a week, 2 days. So that on selecting that, it automatically gets a record of all the sales that you made during that period of time. So this seamlessly helps you balance your financial services. So you can see the total sales, the lab results, the radiology, and the medical drugs. So this is all the money that the hospital collected in the month of November. So they can always view details. And so when they view details, they have access to a couple of visualizations to bring out the bigger picture, so they can see the different branches. We were mainly dealing with the city branch, so its total sales for this month is that. And then it can show you which service had the highest uh, total invoice amount, and that is lab results, radiology, drugs. You can see that the downtown branch, which we weren't dealing with, has 0. And there's also another visualization of pie chart that basically shows you which branch performed better. And you can always generate a detailed report for all branches, and for the different cells. And you can see that the sales report is from November 1st to November 30th, and it was generated on this day and at that time. And you can always print it if needed. Basically, that is the overview of the entire system and how it works. Thank you.